Good morning, or I guess I should say good afternoon. Welcome. This is a different view than you usually get, but this is me, Dr. Polly, with Abundant Health and Wellness, downtown Humble at the corner of Main Street and Avenue C. And this is Tracy. If you have come into the clinic, you know Tracy. If you have not come into the clinic, well, this is Tracy. So we're going to carry on our discussion about Epstein-Barr virus. Now, just to make a disclaimer here, I am a naturopathic doctor. We do not diagnose and prescribe, but what we do is we assess your health via frequencies. And so we have an avatar, we do EAV testing, and what that does is it tells us what vibrational frequencies are at work in the body. So this is kind of a case history with Tracy. And so a lot of people are wanting to know exactly how we go about getting rid of a viral load. Everybody has a viral load. We talked last week and the week before about Epstein-Barr virus, and we said that 95% of the adult population in the United States has the Epstein-Barr virus. So we test for frequencies. Now, if my computer would be camera friendly, I could show you some certain things, but we've tried to do this before and all you get is a big white screen, so there's no point in trying to do that for you. But what we want to know, or what we want to understand, is that when we are trying to assess the body and get the body to come into line with health and to be harmonized and all of your frequencies going in the right direction, we do the avatar and we test. We test for different things. We test for viral load, we test for parasites, we test for electromagnetic frequencies, we test for bacteria, we test for inherent tendencies, traits, miasms. That'll blow your mind if you Google miasms and you'll see what's going on. But anyway, just to review, this is what the Epstein-Barr virus looks like. Now, this particular one attacks the thyroid, and it's significant because we're going to be talking with Tracy today, and this is her journey, so we're going to talk about, it's been a long journey.
Yes, ma'am.
It has been a long journey. So in 2015, okay, this is 2018, in 2015, you had some kind of a manifestation of swollen glands, and we did some energetic testing and we found out that it was a virus, although we didn't name it anything. It was just a viral condition. And so what we did is we did a certain protocol trying to get you over the hump because you were going to be traveling. Remember?
No, that's when I was traveling.
That was, well, you were sick before you went on your trip.
True.
Okay, so you were going to be traveling. So we tried to do some preemptive stuff so that she would be okay. Did not work out that way. So go ahead and bring us up to, not up to date, but tell us what happened on that trip.
That trip, I ended up going out of town to family to celebrate my birthday and ended up celebrating it in the hospital for a full week because I passed out at my sister's house and basically was a human ping pong and ended up cracking 3 vertebrae in my lower back. And so got stuck in the hospital for 5 days, and all I kept saying was, get me back to Dr. Polly, get me back to Dr. Polly.
Right, and so when I would call and talk to her sister, and I would say to her, or I would text her, if I can get you home, I can get you well. You know, so that was kind of what we tried to do. Mm-hmm. So the next year was 2016.
We were good that year.
We were good that year.
2017.
2017 in May. All of this happens in May. Now, May happens to be your birth month.
Correct.
Okay. So, did you have a traumatic birth?
I don't know.
Did mom say, was there any birth trauma?
Every pregnancy mother had was difficult.
Okay. So, there was probably some birth trauma. Mom's gone on to her reward, so we can't really ask her. Right. But this is happening in your birth month. So, 2015 it happened. 2016 you skated through. 2017 we are approaching another trip, correct?
No, we were here working and I was getting lightheaded and dizzy. All those symptoms were coming back and you were like, what's going on? And we assessed and that
it was another viral load.
Mm-hmm.
Okay, so another viral load. So at that time, we worked and tried to arrest it. We recommended that we do RCCP because RCCP is a really good rebuild. It's a really good balancer. We know that she's been dealing with this for 2 years at least that we know of.
Correct.
Same symptoms, same time of year. It's just uncanny, right? So we did the RCCP. You went on your merry way. Everything was pretty good.
So we thought.
Okay. So February of this year, right?
Yes.
What happened?
I got deathly ill, needless to say. Woke up middle of the night to go to the restroom and ended up on my floor and got myself back into bed and basically was incoherent, unable to move. The room was spinning. And of course, called Dr. Polly.
So I remember, I think it was a Thursday because I had to miss my networking meeting to come and get you some assistance, which was fine. So what we did is we did some assessment then, and we found that this virus was just crazy. And so we did some essential oil therapy. We did a lot of different things because really she was very incoherent and things just weren't working the way they needed to be. And so we wanted to, you stayed in bed for what, 3 days?
Yes, ma'am.
Yeah.
3 days.
So it was really just like a knockout punch. And so we assessed, there were some parasites, there were some different things going on that were causing the complications. So we did a protocol. You started to feel better. We did some assessments. We decided at that time that it was a viral load. Is that what we did?
Ma'am.
Okay. So this was in March. This happened in February. So in March, we decided to attack the virus. And I think you did RCCP again, did you not?
No, I did some of these components to balance me, but I didn't do the full 7.
Okay. So then in June, you went to Kentucky.
Went to Georgia and Kentucky for vacation. Mm-hmm.
So just to remind you from last week, what are the things that trigger Epstein-Barr virus? Trauma triggers it. So this was very traumatic for you going to Kentucky because you have a son who is facing deployment. Mm-hmm. And part of the reason that you went was to spend time with the son because he's going back into active areas of distress. And so obviously distress for mom. Mm-hmm. Mom comes back home and you are absolutely a mess.
Yes.
Face was all broken out, some kind of allergic reaction. It looked really, really bad. And it was like, oh my goodness. Every time she travels, she comes back with a problem, right? So we don't like her to go away because we love her and we love what she does here. And so, anyway, she comes back and she is just all broken out. It looks like a very, very bad allergic reaction, swollen eyes, swollen face.
Blowfish.
Yeah. So it was kind of a sad situation.
Yeah.
So, and we're not trying to make fun of it, but we have been spending
a lot of
time from June to the present day trying to get this virus under control and to get it eradicated. Now, what you need to understand, the reason we're doing this kind of expose, as it were, the reason we're doing this is because people think that they can come in and that holistic medicine works and it works fast. It does work, but it does not work fast, okay? It just does not work fast. I wish I could say that all of our potions and everything are magic and they work overnight. They don't. Sometimes they do. Most of the time they don't. When we're dealing with a recurrent issue that is time and time and time again, and this is over several years, it is really embedded in the tissue. And so this is something that when you go to the doctor, obviously if it's a viral issue, you go to the doctor, you're not going to be able to have antibiotics because why? Antibiotics do not work on viruses. Okay. But the doctor, if the doctor's not paying attention, and we see this time and time again that people go to the doctor, they've got a viral infection, they'll do antibiotics, and all that does is weaken your immune system. If you've had this time and time again, now this came to the fore in 2015 that we really started to pay attention.
And I wanted to say, in 2015, I'm not against medical at all. But with the incident that happened and I was passed out, obviously my sister called an ambulance, 911.
Of course.
I was rushed, obviously. I was in the hospital 5 days, and Dr. Ply knows all this. I was in there for 5 days. I had 4 specialists. I was hooked up on heart monitor, and I had, you name it, they did it to me. But when I was discharged from the hospital, I had no clear diagnosis. They could not tell me why I kept passing out, why my blood pressure tanked. I almost died in the ambulance. They literally had to pull over. Anyway, but I just knew if I could get back to Dr. Polly that I would find something. And so we knew my back had 3 cracked vertebrae. I was in a brace for 10 weeks. That was duh. But we didn't know why. And that's when I came back, Dr. Polly assessed me. And that's then when she found the virus and we could start this
unraveling
journey.
Unraveling it. So this is what you need to know about a virus. Anytime you've got swollen lymph nodes, anytime you've got eustachian tube issues, you've got a blocked flow. And so we need to find out what is blocking the flow. Now, if it's just a bacterial infection, that's pretty easy to take care of. But if it's viral, these viruses are very opportunistic. They want to live in the tissue. They don't want to be eradicated. Why? Because they are life forms. I call them alien life forms. Dr. Deb calls them Klingons because they come into your environment and they cling on to everything that you have. A lot of these viruses are stealth viruses. I mean, they have buried themselves so far deep into the tissue that, like you say, there's no quote-unquote diagnosis because they're very adaptogenic. Right. And so they get into the body and they hide in the body, and they are absolute parasitic in nature because they sap your energy, they sap your resources, all of your nutrition and that kind of thing. And so just because you go to the doctor and the doctor says there's nothing wrong does not mean there's nothing wrong.
Correct.
You could be dealing with a stealth virus. Now, a lot of the viruses that we have that are stealth virus, one is the Epstein-Barr virus, one is the cytomegalovirus, and we found that as well. So Tracy's just a treasure trove of vibrations, okay? Aberrant vibrations. So this is what I want you to know here. When your health is good, when your health is perfect, when you have good blood work, when your body is working the way it needs to, all of your frequencies are going to be in the normal range. Now, for our intents and purposes, when you come in, we're going to look at your eye, we're going to see what the strengths and weaknesses is in your DNA. Then we're going to do the EAV, which is a transdermal analysis on the traditional Chinese meridian points. Doesn't hurt, it's not invasive, but what that does, it assesses the frequency of that meridian. So if the frequency is within normal range, then hopefully that means that meridian is functioning properly. What that means is your immune system is doing what it needs to. The macrophages, the phagocytes, all of those little critters are doing what they need to gobble up the viruses, gobble up the bacteria, gobble up the parasites, and do all that. When you've got the swollen lymph nodes, that's an indication that there's a blockage there. There's something in the lymph that the lymph is having a hard time to digest and eat and take out of the body. So what we've done with Tracy, just because she's like my little human guinea pig here, I see her every day, and so I'm able to assess her condition every day. And most of the time when we're dealing with things, usually you'll come in every 30 days, 60 days, maybe 90 days, depending on what we're working with. Because this thing was morphing so quickly, we had to do an evaluation about every 2 weeks.
Yes, ma'am.
Right? And so what that does is it gives us a window into what's happening in her body so we can change the protocol. So just so you know, when you've got a protocol that works, you're going to have a reduction in the symptom within 24 to 48 hours. Maybe a little bit earlier, but definitely between 24 and 48 hours if we're working on an active viral load or an active bacterial load. And active is a key word. The body wants to stay in balance. The body is going to let me see what I can see only when the body is ready to take care of it, when the body has the energy resources that it needs to take care of it. So you've heard in the history that we did RCCP multiple times. We did that because it takes a lot of energy to detox. It takes a lot of energy to be sick. That's why you're tired when you're sick. And so we don't want you tired. But if you're fighting a stealth virus, if you're fighting something that's hidden and cloaked, we call them cloaked disturbances, then we've got to give the body what we call heat shock proteins, right? And what that does is it ferrets out where the stealth viruses are. It ferrets out where the parasites are, where the bacteria is, where the heavy metal is. If the body is not strong enough to deal with it, the body won't let me see it. So that's just a good safety measure for the body. So I don't want you to get the idea of, oh my goodness, we've had this issue, we've had to reassess every 2 weeks, something's gone wrong. It's not that something's gone wrong, it's that something has gone very right, that we're able to address it, change it, address it, change it. And so every 2 weeks we've had to change the protocol, either with imprinting or potentizing or whatever we had to do to get you over the next hurdle so that you could eventually progress to health and wholeness. So it is a long, long journey. But what did we talk about last week? The Epstein-Barr virus, right, is very, very closely aligned with breast cancer. Now, I know we're 2 days away from Breast Cancer Awareness Month, which is always in October. But one of the things that I want you to know is that in a cancerous breast tumor, they always find Epstein-Barr virus. Okay? So, do you have cancer in your family?
Yes.
Both sides? Both sides. Is it female cancer?
Yes and no.
Okay, so you've got multiple levels.
Yes.
Okay, so this is one of the good things, and this is one of the blessings that we've been able to find this virus, been able to go in, and we are in the process. I don't think we're through 100% yet, but we're in there. We're in the process of eradicating and disabling this virus because why? We don't want this virus to continue its manifestation in her body, and then maybe one day down the road she would have breast cancer or something like that. And so when you're dealing with a virus 24/7, what that does is it eradicates your immune system. And so if you've been paying attention for the last however long we've been doing this, when your immune system is attacked, when your immune system is not functioning properly, what happens? The immune system breaks down. What is an autoimmune disease? An autoimmune disease is a label that the medical profession puts on a dysfunction where the immune system does not go after the viruses, the parasites, the bacteria. It attacks your own organs. So this is what we get when we get fibromyalgia, when we get diabetes. A lot of times it's an autoimmune thing. When we get Crohn's disease, when we get rheumatoid arthritis, when we get Lou Gehrig's disease, when we get chronic fatigue syndrome, when we get Hashimoto's, when we get lupus. All of these are labels, and at the very bottom of it is an immune system that is not vibrationally sound. And so what we're able to do with the products that we have is we're able to shore up that immune system. We're able to rebuild the bone marrow. We're able to rebuild the white blood cells, the red blood cells, the platelets. We're able to rebuild the lymph nodes. We're able to rebuild the gland. So if it's Hashimoto's, it's thyroid. So one of the things, and just gonna kind of bring this out because this is kind of a fun thing.
Oh, yay.
If you are trying to heal the body naturally, there is something called Herring's Law of Cure. Okay, so you can look that up. Konstantin Hering, he was a German medical doctor. He's you can find him anywhere. He's just awesome. Anyway, what he said is that you will heal from the inside out, from the top down. Okay, so you can, as you are getting rid of things, as you are bringing your body back to health, you can revisit things that you had in the past that you thought were done with, right? And so one of the things in your journey, right, is that you had some goiters.
Yes.
Right? And
27
goiters. So they did not remove your thyroid.
I refused, correct.
Right, but they irradiated it.
Yes, ma'am.
How many radiation treatments did you have?
30.
30. She had 30 treatments. So that's quite a few radiation treatments. What you may or may not know is that radiation stays in the body forever. Yeah, they don't tell you that.
No.
You have got to go in and chelate that radiation out of the body. So this is a really
because
important
that was
thing.
26 years ago.
That was 26 years ago. Do you remember what month it was?
Yeah.
What month was it?
I was diagnosed April and I started June.
Started June. Okay.
So May was right in the middle.
May was right in the middle. Okay. So remember Epstein-Barr. What triggers Epstein-Barr? Physical trauma, emotional trauma, heavy metal toxicity, radiation. Okay, so as we're moving through our journey, I'm not real sure which cycle we were in, but things started happening. Things just started happening. Remember, she had some allergic response and all that kind of stuff. Well, all of a sudden, what happened was from her neck all the way down almost to the thymus gland, which your thymus gland is just right here, if you can see that. From here to here, she was just glowing. And not in a good way.
No.
Okay, not in a good
still
way.
am.
And so we were able to, again, assess the body, and what we saw was this radiation was reactivated, and she was hot.
Mm-hmm.
You were actually burning to the skin.
Yes.
And so we were able to tweak the protocol to be able to get this radiation to release. And you could almost see day by day that the pink would go away. And I think you posted on Facebook, look, I'm white. I'm white here. And that's not, if you don't know the history, she was really, really red, like eggplant purple red because of all of this radiation. And so this is a good thing. It's a bad thing because she didn't feel well.
No.
But
Painful.
It's a good thing because the body is retracing insults that the body had before, so that we can go in and we can eradicate these things. And this is called getting rid of obstacles to cure. Okay? So we all have obstacles to cure. It can be trauma, emotional trauma, physical trauma, children that children don't do well, losing a spouse for whatever reason, losing a home for whatever reason, financial difficulties, losing a job for whatever reason. All of those things are emotional, and it can be physical torment. Now, would you like to share with us how many surgeries you've had?
Gosh. A lot. Multiple.
Okay.
I don't do anything easy.
Yeah. So she, without, exposing the whole thing, you had an accident that almost cost you your leg.
Yes.
Okay. They wanted to go in and amputate the leg.
I fought 9 months to not have my leg amputated. It was 27 years ago. Fell down my stairs in my home and ended up 2 years learning to walk again. And then I spent 10 years, 85% of the time, handicapped. I had to be in a wheelchair because I could not walk. I couldn't go to the grocery store and walk. I had to be in one of those little electric chairs. I couldn't go to the mall. I couldn't go to theme parks. I had to be in a wheelchair. And I did that for 10 years and then had another surgery where they cut all the nerve endings off. So I have no feeling in the right leg.
So that's a lot of physical trauma. So what sparks a manifestation of a virus, right? What sparks it? Trauma, emotional, physical, mental, spiritual, okay? So just want to throw it out there. Healing, when you heal holistically, it takes a lot of time, and it can be a hard road. We did talk about going and get some medical intervention.
Yes.
We did talk about that because when she came back from Kentucky, she was very swollen. She said it's a blowfish.
Blowfish.
Okay, so very, very swollen, very inflamed. So what you would do at a medical doctor is they would give you a steroid. Now, a steroid would have resolved the inflammation,
Correct.
probably would have resolved the skin issue. But what steroids do is it takes whatever the body is fighting and it drives it deeper into the tissue. And so we don't recommend a steroid unless it is a anaphylaxis, life and death situation because of that. However, because you have been fighting this for several months, we did talk about maybe you need a mental break, maybe you need an emotional break, because you're just fighting with your skin this whole time.
Yes.
And so we talked about, did you want to do that? And certainly if she felt like she needed that, we would definitely support her in that. And your comment was?
No, I want this out and I want it gone.
Yeah. So just throwing it out there, holistic healing is hard. It's possible. It's very possible. It's not easy. There has to be discipline. There has to be rest discipline. There has to be food choice discipline. There has to be a willingness to be reassessed as often as the body needs to so that you can breach that chasm and get from this offense to this offense. And we're talking about a physical offense in the body.
Yes.
So anytime we are assaulted in whatever way, that gives a opportunistic window for a virus, a parasite, or a bacteria to come in. Why? Because it shocks the immune system so much. The immune system goes to one area, which is what it's supposed to do, but because we live in an environmentally polluted world, our food is environmentally polluted. We don't get the nutrition that we need. So our frequencies are not where they need to be. So it's all about harmonizing the frequencies. It's all about dealing with the body as a whole at the cellular level to see what the body wants to do so that we can get the body well. So hopefully you're not confused. Hopefully you're not discouraged, because we're not trying to discourage you, but this is a real life situation.
Yeah, but hopefully those of you that have come into the clinic and have seen me, especially these last 3 months, some have asked, and I'll tell you, I'm an open book. I don't care. But I can't hide the exterior, although I did wear this because I didn't want you to see all the redness. But when you come in, if you ask, I will tell you. But those that have come in have seen the different phases.
Progression.
Yeah, and it's not been pretty.
It's been, but you know what? She's come to work every day.
Yeah.
In pain, kind of embarrassed.
Oh, very embarrassed.
And I mean, I'm amazed at the stamina that she has as far as being willing to work with this through the good, bad, and the ugly in order to get the resolution that we need. Because what happens if we don't address Epstein-Barr? What happens if we just let it lie fallow? Then it's going to present itself at an opportune time. We live in a dirty world. We live in a traumatic world. It's only one more insult away from manifesting. So it's really, really important that we get this done. I think it's really important that we share a real life story, because a lot of what I'm able to talk to you about is theoretical. This is what we would do if we found this. This is what we would do. So we are documenting. We are documenting so that we've got a research project here. So this could take a few more months to finally resolve. Okay, but I think we've cracked the back of it.
Oh, please, Jesus.
I really think we have. And so now it's just a matter of realigning things so that things can come to the place where we need to be harmonized so things can just go further. I'm really hoping that in May, when May comes around, 2019, that we're not revisiting this viral issue. So we'll keep you posted there. Do you have any final words? that you would like to say?
No, just come see her. She's amazing.
All right. Thank you so much for tuning in. I know there's been tons and tons of questions, so we'll get back to those this afternoon. Bless you guys. Have a great weekend. Don't be daunted. Holistic health takes a long time sometimes, but it is so worth it.
Yes.
So thanks for joining us. Let me know if you have any questions, and we'll see you next week. Take care.